right. Good day, everyone. Thank you for that very generous introduction. I'd like to congratulate the leadership of the ISLM for this successful lifestyle medicine conference. Thank you for inviting me again, and this is an opportunity to share with you and discuss about one of the most important modalities that we practice in lifestyle medicine. So I'm tasked to discuss about making food interesting for Gen Z, and then we'll be focusing on how culinary medicine can play a role for this generation. Now, let's have these three objectives as we move forward. We'll discuss the role of lifestyle medicine in addressing the burden of chronic disease among the Gen Z population. And then we'll define culinary medicine and then describe the impact of healthy cooking to address concerns on social determinants of health in improving population health outcomes, specifically for the Gen Z. Now, when you look at the demographics, you will see that the Gen Z demographic are those that are born between the mid-1990s and late 2010. And this is, in fact, one of the largest population groups globally. And Gen Z consumers are demanding on and vocal, in their beliefs as well. And they are aware of social, political, and environmental issues, and they share their viewpoints on social platforms. And when considering food and recipe development, the eating habits of the Gen Z consumer cannot be described in simple trends alone. So their food choices are influenced by their lifestyle priorities, such as sustainability, health, natural ingredients, of course, the culture, and then peer pressure, so on and so forth. Now, when you look at fad diets, we know that diet fads are nothing new. And every decade is marked by a new trend, whether that's a grapefruit diet of the 1980s, the Atkins diet of the 1990s, or the juice cleanses of the 2000s. But then Gen Z is bringing a new why to diet choices. So people have traditionally turned to restrictive or specific diets to lose weight. But Gen Z shows that the reasons behind individuals' diet choices are often multifaceted. In fact, the IFIC Food and Health Survey reports that Gen Z is likely to choose specific diets in an effort to improve their energy, their sleep, or mental health rather than to lose weight. Now, this trend is also echoing through other generations. Now, the survey found that about 30% of the participants said they choose specific diets in order to lose or maintain weight, and 29% said they aim to improve digestive health. About 28% hope their diet choices would lead to a healthier cardiovascular system. And it's also interesting that the Gen Z is also showing less interest in alcohol than the previous generations. In fact, the report have found that Gen Z is drinking less than the millennials did when they were their age. Now, when they do choose to drink alcohol, the Gen Z often reach to liquor rather than beer or wine. Now, this means that more companies are actually churning out lower calorie, ready to drink cocktails, as well as non-alcoholic beverages like mocktails and non-alcoholic beers. Now, it also means that consumers are increasingly expecting these options at the restaurants. Now, finding out how young future consumers felt about healthy and sustainable food consumption, in this article, they found that it's important, right? Since early adulthood was shown to be the crucial period for building certain autonomous lifestyles and habits as recommended. So the Gen Z was designed as the specified target demographic in this paper. The framework actually examined the experiences of Gen Z as well as challenges and opportunities pertaining to behavioral patterns. Now, it also examined the present habits, including those related to organizing, purchasing, cooking, eating, and storing, as well as the future goals. And the application development procedures benefited greatly from the design framework. Now, they found out that there is a mediating role of satisfaction that has emerged significantly among the Gen Zers. Now, looking at the outlooks on health among the Gen Zers, somewhat unsurprisingly, for youngest adult generation, most Gen Zers describe their own health as excellent or very good, with 59% saying so. Now, their healthy self-perception supports the Gen Zers definition of healthy food. I mean, when asked to select the top attributes that define a healthy food, the most popular definition among Gen Z include food that was good source of nutrients, and that's then 35% of the respondents. And some of the respondents, about 34%, said it's supposed to be the food that was fresh. And about 30% would say it's supposed to be the food that contain fruits and vegetables. So when asked about their most sought after health benefits, it's evident that the Gen Z prioritizes bolstering both their physical and mental health. And the top benefits they seek out from foods, beverages, and nutrients were having more energy or less fatigue, or improved sleep, or emotional or mental health, and digestive or gut health. Now, seeking out emotional and mental health benefits could be in part due to the Gen Zers' self-reported level of stress. And when asked about their stress level over the past 6 months, 73% said they felt very or somewhat stressed, with other third saying they were very stressed. Now, among those who sought to improve their nutrition or diet to manage or reduce their stress, over 2 in 5 respondents specifically cited practicing mindful or intuitive eating to accomplish stress management. They were also likely than the Gen Zers to say so. And at the same time, the Gen Z were more likely to have a low score when using a mindfulness index that analyzed their frequency of engaging to various mindful eating practices. So as an example, the Gen Z were more likely to say they always or often eat when they're feeling stressed, and then to feel guilty about what they have eaten. In addition, labels on food and beverages and beverage products are highly influential in this generation. The Gen Z most regularly buy foods and beverages because they are labeled as natural. There are about 46% saying this, or having clean ingredients, or being organic. And this is higher compared with the baby boomers, looking at labels such as natural, clean ingredients, bioengineered, containing ingredients, or small carbon footprint ingredients, or plant-based, were all more likely to be influential with the Gen Z. Now, their preference for these labels is fairly unsurprising due to this generation's commitment to environmental sustainability, as well as their preference for plant-based and clean eating patterns. Now, when you look at the information sources for dietary nutrition, we know the Gen Zs are the ones who are connected with the internet, they're using all the dietary applications, so on and so forth. Now, we see that there's a higher number of Gen Z population who are more aware about the My Plate graph compared to the boomers, the baby boomers. And another thing in here is the issue with regards to the trust in terms of the front of pack labelings. So they are likely saying that trust in government agency has somewhat increased, and the trust in scientific, although the trust in scientific studies has remained stable among the Gen Zers. But there's a shifting perspectives on food and health. And in here, you'll see compared with a decade ago, fewer are giving a lot of thought to healthfulness and the ingredients. So that means, and then this is especially in comparison with the baby boomers and the millennials. And about 7 in 10 believe that the changing science in nutrition makes it hard for them to know which to believe. And they said it's increasingly confusing every single year. And they said this is because nutrition information seems to keep changing and they're confusing, and then online tools are also giving them some information, and different online tools would have different explanations and different sets of information that they give. And like I've mentioned earlier, the younger generations are more likely to agree that online tools and mobile apps can actually help them and guide them with regards to dietary intake and physical activity. And in fact, this is also sad because the preference for medication over lifestyle change has increased dramatically in the last decade. So a lot of them would say, I would rather take a medication for health condition than change my lifestyle. And this is, I think, one thing that we're supposed to focus on when we're providing continuing medical education, or when we're providing, when we're choosing topics that we can actually involve these concerns that was published in the survey. Now, with regards to purchase drivers and shopping patterns, we know that the Gen Z is commonly associated with the digital world, and grocery shopping is no exemption. And over one third of the Gen Z shop online for groceries at least once a week. And this generation is more likely to do so compared to the baby boomers. So, and younger generations are also aware that and they are more concerned about the environment compared to the past generations. So, and nearly 6 in 10 are concerned about the food waste, and younger consumers are even more. So when you look at this, you're actually looking at a potential for enticing the Gen Zers, to eat healthier because of the sustainability and because of planetary health. They're more concerned. They're the ones who understood the benefit of eating healthy, because they can benefit not only their health and at the same time the planet. So, in that connection, I'd like to share with you the recently published planetary plate by the Eat Lancet. And I like this a lot because this is somewhat translating what we are actually campaigning in lifestyle medicine, right? So you will see this is the recommended planetary plate. They are saying we have to consume 50% of the plate should be occupied by plants and vegetables and fruits, and then a large portion of that should be occupied by whole grain. And if you look at dairy and animal source protein, they are tiny bit, right? And they're advocating that people should eat plant-based sources of protein instead. Now, they're saying we wanted to achieve a planetary health diets so that we can feed sustainably 10 billion people by 2050. This is the planetary health recommendation. So when you look at whole grains, tubers, and starchy vegetables, all vegetables in general, fruits, dairy, protein sources, you will see here the specific recommendation. And this is looking at the co-benefits on dietary change, not only for personal health, but for climate change as well. And they've found out that in this European cohort study, that it reduces premature death by 63%. It prevents up to 40% of all cancers, reducing gas emission from food system by 50%. It will free up 62% of the farmland. So in fact, this plate is actually showing you that we have to increase consumption of fruits and vegetables or plant-based products to over 100%, and decrease consumption of animal-based protein to as low as 28 grams per day, right? So going back to the diets and the eating patterns, you will see that the Gen Zers are actually increasing their frequency of snacking all throughout the day. And all the fruits have been the most common sources for snacking in the morning. And this is actually becoming better because, again, the Gen Zers are becoming more concerned about population health. And with regards to mindfulness index for consumers and then the eating patterns of behavior, you will see that they have a lower index score compared to those of the previous generation. Now, with regards to nutrients and the desired benefit, again, I've mentioned earlier that the Gen Zers they wanted to eat food because they wanted to improve their energy, they wanted to have less fatigue, and that's their priority. and they wanted to improve their sleep. That's their priority, not really into weight loss, right? Now, vegetables and fruits are the most common targets for energy and weight loss. They've also found that vegetables and fruits are also key to improving gut health and heart health. And this is the result of the survey. And this is compared to those that are taking dairy products, probiotics, and prebiotic supplements. Now, in this survey, they found that 3 in 10 of the participants report eating more protein from whole plant sources compared to the previous generation, and that's a good thing. And of those limiting or avoiding sodium, you will see that more than half try to limit salty foods coming from processed products. So in terms of food production, they've also found out that there's a perceived healthfulness when they are seeking for natural labels. So that means farm produced ingredients compared to those artificial ingredients. And they have a good familiarity, like I mentioned earlier, with regards to bioengineered foods and ingredients, and they are more concerned about consuming natural ingredients compared to bioengineered ingredients. So here, when you look at how do you tweak the plate so that you can entice the Gen Zers to consume healthier, because the challenge is they have the ease, they have the access, easy access to processed foods because they know how to order just quickly, and just quickly order online, and then in just an hour, they already have their fast foods in front of them. They already have their processed foods in front of them. We have to take advantage of those trends that we saw in the health survey. So since the Gen Zers are more concerned about the natural ingredients that they can find, maybe we just have to encourage them and make them aware what do we mean by the natural ingredients. And from there, we talk about how much calories they can take or they can get from those kinds of ingredients. And since Gen Z is not only interested in how their diet will impact their weight, but also their overall health, culinary professionals may also benefit from learning more about nutrition and wellness. And this is where culinary program can be tailored, so that we can give them the opportunity we can give the Gen Zers an opportunity to be trained in terms of nutrition knowledge, behavioral change, and of course, cooking skills. And this is where the 6 pillars of lifestyle medicine can come in, particularly nutrition. And nutrition is one of the key points that we also prescribe patients for lifestyle intervention. And you know that culinary medicine is one of the novel methods and approaches that we use in applying lifestyle medicine in line with nutrition prescription, because this is where we wanted to translate those nutrition prescriptions on the patient's plate. So let's say, for example, you wanted to prescribe a calorie-restricted diet because you wanted to decrease the patient's, and this is a consented strategy or approach, and you wanted to, and the patient also consented to decrease their calories, or this is a restricted calorie diet. So, but how do you translate that on your patient's plate? How can you make it realistic for them so that it could be a SMART goal and it could be doable, so that at the end of the program that you give the patient, you will see the expected outcome and expected result. So that's where culinary medicine can come in, and this is usually integrated during the shared medical appointment. So culinary medicine is a new field in medicine, and it's integrated in lifestyle medicine, in integrative medicine, and also in nutrition and dietetics, and it's applied in many different educational platforms. So it's an evidence-based field that brings together nutrition and culinary knowledge and skills to assist patients in maintaining health and preventing and treating food-related disease by choosing high-quality, healthy food in conjunction with appropriate medical care. So this is where we talk about how do we help patients with diabetes achieve remission through the food that they eat? How do we help patients with hypertension decrease their blood pressure by tweaking, the plate that they eat? So this is where we also acknowledge transition process, and this is where we also respect the patient's preference. And that's why in culinary medicine, behavioral coaching is really necessary. We meet patients from where they are, whatever is doable for them, whatever ingredients are usually available for them, whatever food or plant-based ingredients that's familiar to their taste buds, we begin from there. And we always communicate with the patient the way that we can let them solve their nutrition challenges, right? Their dietary challenges. So yes, we're experts. We know what to do. We know that this is the best diet for them. But again, in terms of prescription and implementing this at the patient's level, we wanted this to be doable. And so the solution should come from the patient. So I just wanted to show you this video, and I just want to make sure that you can hear this.
Here at Spectrum Health, we're working closely with our resident programs in internal medicine and pediatrics, as well as family medicine, to help them learn more about the direct link between food and health.
Blending the art of cooking with the science of medicine is very important because there's a lot of good research out there on the impact of healthy nutrition or better nutrition on health outcomes. But many healthcare providers have no idea how to work with that science of nutrition and actually translate it into healthy eating behaviors.
Students learn the nutritional science, they learn how to create healthy recipes, and they learn culinary skills. And when you combine the three, they can really translate that into their home kitchen.
It's important to bring medical students into the kitchen to show them cooking skills so they can become comfortable and confident themselves. Once they understand how easy it is to prepare a healthy meal from scratch at home, they then can turn around and bring that to the patients and empower the patients to do the same.
When patients hear me talk more candidly about diet and nutrition, they're actually pretty surprised. Most physicians don't get a ton of formal nutrition education, especially after medical school, and they're surprised to learn that I'm very interested in helping them achieve a healthy diet and learn how to live a healthier life.
We are seeing and treating diet-related disease and really need to find an innovative approach as to how we talk to patients about food and its direct link on their overall health.
When we bring a medical student into the kitchen, what we show them is practical skills they can use not only at home, but by teaching them practical skills on food preparation, we teach them also how simple it could be to work with fresh produce and fresh ingredients and plant-based ingredients.
I have several patients and their parents who ask me questions in the office about healthy eating and how to incorporate healthy foods in their diet, and I knew that this would help me get there.
Eating better food myself helps me to talk to my patients about diet and nutrition because I'm a better example for them.
We're really talking about behavior change, which can be very challenging for patients, and we know that it's hard to make changes in our own lives. Our ability to talk to medical students and help change their behavior, they're then more likely to talk to their patients about it as well.
All right, so that's Spectrum Health. That's actually integrating culinary medicine in their medical education, in teaching medical students, residents, and even doctors, so that it can be integrated into their management for patients, either they're hospital-based or clinic-based. So like I've mentioned earlier, we use culinary medicine because we want to demonstrate healthy food that can be inexpensive and easy. And so that this is where we challenge the taste buds because we wanted the food to be palatable for them, and we wanted the food to be actually sustained, in terms of consumption, right? So again, culinary medicine combines nutrition education, cooking skills, and of course, healthy behaviors. And this is where we practice the protein flip. Now, when you say protein flip, this is where we wanted patients to consume more protein from plant-based sources compared to the animal-based sources. So it's not only physicians who are actually tackling this subject, it's more of the people in the hospitality industry, the chefs, because they wanted to increase consumption of plant-based food compared to animal-based food. So this is just an example of a pizza meal makeover. So if the Gensters usually used to eat this kind of plate, what we can do is to tweak the plate so that we increase the number of fibers, on the plate and decrease the calorie, because we know that fiber is 0 calorie, right? And we also can further tweak the plate into these kinds of plates. So they still got to eat the pizza. They still got to taste the cheese, and then the portion of the pizza that they like. But again, we've already tweaked the plate so that it contains more fiber and it's very filling. It's still delicious, but then it has lesser calories. Now, this is an example of a chicken meal makeover. So here you will see that this is the usual chicken bowl that any Gensers can eat. Now we can tweak this by increasing fiber from when we include salads, on the side, so that it decreases the amount of calories and it's also filling, right? And we can further decrease the calories, by increasing the number of fiber by adding a bowl of beans, right? So this is just an example of a tweak or a flip plate, right? So this is a protein flip. Now we can also do dessert flip, right? So if this is the usual dessert that people would eat, this is the conventional amount of cakes that people would eat, we can actually increase consumption of the fruits right there so that it decreases the volume of the cake, and we can further give them bite sizes of their favorite pastries or cakes and then serve them more fruits instead. And we advise them to eat the fruits first, because remember, when they eat the sweet cakes first, then all the rest will be sour. So we want them to taste the sweetness, the natural sugar coming from the fruits before we ask them to take the pastries, because after eating the fruits and then they eat the pastries, to them that will be too sweet already. Okay. So lastly, I want to share with you what we do in the Philippines. So this is us in the teaching kitchen. So these are our medical students doing their culinary medicine session. We have this every semester. We expose our medical students in the teaching kitchen. As early as first year, we already exposed them to the culinary medicine, teaching them on how they can bring patients, into the teaching kitchen by improving their dietary practices. And this is what we also do in the community. This is community-based lifestyle medicine program. And again, during shared medical appointment, we integrate culinary medicine in our session. It's an enjoyable experience where you get your patients' hands dirty. They cook, they learn, and then they enjoy the foods that they have prepared. We also include this in grade school education, in learning institutions, right? So here in learning institutions, this is where we start implementing or teaching students, grade school students, to plant, because children, they want experience, right? If you only give them a bowl of salad, they won't eat that one. But if you teach them how to plant, and then you let them harvest the vegetables and then involve them in the preparation, they will more likely taste the things that they have made. They will be even very proud and appreciate what they did. So that's what we learn from students. So we involve them in the cooking process, in the food preparation. So they actually appreciate the experience, and they would love to taste the food that they have prepared. And this is our teaching kitchen. So that's me with the doctors with us. So this is combined doctors and patients, and we tweak ingredients, right? So we make the same barbecue, but this time this is plant-based. We decrease the number of calories by increasing the amount of fibers. So we serve foods that can be a good alternative or substitute for dessert, main course, and then of course salads, drinks, etc. Right? So that's what we wanted to achieve for patients and of course for our healthcare providers as well. And this is what we can do for patients lifestyle medicine and addressing the burden of chronic disease among Gen Z population. We also define culinary medicine and we describe the impact of healthy cooking so that we can address concerns on social determinants of health, improving population health outcomes, specifically for the Gen Z. So if you have questions, I may have time to answer and address them. These are the references. Thank you so much for giving me your time.